Hey everybody, Howard Gearhauser here alongside my dad, Dr. G. Today's video is for those of you who are suffering from pain or even chronic pain. We want to give you some alternatives that might help deal with the pain outside of the mainstream recommendations of opioids and some of the other pain medication. So this one's going to be mainly my dad just discussing some of the alternatives that he's used in his practice that maybe you haven't heard about. So hopefully you'll gain some insight on some different things that you can try out. Dad, you want to take it away?
Yeah, sure. So we're talking about pain, chronic pain. It's a huge source of misery for human beings in our culture. It causes disability. Uh, it's very expensive. A lot of times you're bouncing from doctor to doctor, and we have these pain clinics. And the pain clinics in the recent past, a lot of them mainly dealt with medications, which mainly was the opiates are at the end stage where you have chronic pain and no one's been able to, say, hey, here's how we cure it. No one's been able to tell you that. Then you get on this pain management type of course. And a lot of times that can be opiates, but nowadays we're thinking a lot like of other things that have been shown to help pain, things like meditation and yoga. And so I'd highly encourage all of that. But what I wanted to mention today is sometimes there's an alternative to something that may be addressing the cause of the pain and therefore maybe cure you of the chronic pain problem. Now, as an example, I will tell a little story. I'm changing the names and the sexes and all that just because of patient confidentiality. But I had a patient that came to me kind of as a last resort. Had been bounced around for 2 years. What happened is they lost a few digits off their hand in an accident. And after the wounds cleared, she had pain in her hand, in her forearm, and in her arm. And this pain was severe. And she had all kinds of different treatments and rehab and different things. And she couldn't tolerate opiates. So she was at the end of her rope, and somehow she found me. And she was, saying, if you can't help me, it's time for suicide. And so, I didn't want to hear that. I was, I'm not a pain specialist, so I'm thinking, what the heck? First, why'd they send them to me? But it was like through the grapevine, they heard Dr. Gearhauser does some shots for pain. Maybe he can help you. So I saw her, and I really didn't think I could help her. But I had just learned a new technique within the past year, and I had been doing it on a limited basis on a few patients. And so here was kind of, wow, maybe I learned this technique for this woman. That's just what my mind was telling me. I no idea why, but my mind's telling me, because I almost said, no, I don't want to take your money for an office visit because I don't want to, lift your hopes up thinking that I'm going to have any idea of what you should do for this pain. So I just go, okay, you don't have to charge her or whatever. Just examine her like you were taught. So I examined her like I was taught, and I was taught to examine the sensory nerves that are affected. So where she has a pain, and you just push on the surface. And it's like, I push on the surface, where I learned these superficial sensory nerves were. I pushed on the surface and, like push here, ow, push here, ow. And I go, oh, just like I was taught that's where this nerve is going to hurt if it's inflamed, and that it will move up the nerve. It'll continue to move up. Like once it goes to the arm, then it'll go to the shoulder, then it'll go to the neck, then it might go to the other arm, the other hand. So this can progress. So the way the treatment goes is you inject a tiny amount of sugar water in each of those tender points, which correspond to where a sensory nerve branches near the surface of the skin. So I went through this, injected those spots with the sugar water, diluted sugar water and sterile water. And lo and behold, as I was taught, the pain should be 100% gone or almost 100% gone. So this lady, her pain hadn't been 100% gone in 2 years, and she was crying with joy. But I know, as I was taught in this procedure, that that lasts anywhere from 4 hours to 4 days, but then the pain usually totally returns. So, you know, she thought, is thinking, and I told her before, that's what's going to happen. So she realized, you know, the pain's going to come, but she was so happy. She was so grateful. So the way you do this procedure is if that initial session works, like it did with her, took away her pain, then you would redo this same scenario of wherever she's still sore, you would treat it again with this exact same shot, just below the skin. You don't go in deep. And again, the pain should be relieved. And usually it lasts a little longer. And then after about 6 treatments, you do it once a week. After 6 treatments, they're cured. And that's exactly what happened with this woman. And the workers' compensation people called me because this woman, you know, just raved on about, oh my God, I can't believe how many experts I saw. And this guy who, you know, isn't even a pain specialist cured me. So it was gratifying for me as a physician, and that got me to do this more, to check this scenario out on a lot of people. So that the idea is the nerve usually with an injury, or it could be with an overuse, or it could be with a constriction, like from a scar or something, but usually it's from an injury, that the nerve turns on the pain signals, turns on inflammation, because that's how we heal. The nerves orchestrate inflammation in the area that's injured. Inflammation is part of the healing process, but inflammation also causes swelling. So one of the things that happens often is these nerves go through holes in the fascia of the muscle, and where they do that, they get strangulated when they swell. And so what sometimes happens is a vicious cycle, and this is a theory. There's a lot of evidence for it and not much evidence against it, but it's not a proven theory, or it's not proven mechanism, but it's a theory. But there are studies that show these nerves do get strangulated when they swell. And the theory is that this creates more inflammation. The inflammation creates more pain. And then the nerve gets more pain signals, then creates more inflammation to try to heal what's damaged. And it becomes a vicious circle. And that vicious circle now is chronic pain. So people that have pain from an old injury that didn't go away, or even an old surgery, like I've done this many times with people who've had hip replacements or people who've had knee replacements, their knee hurts just as bad after their surgery. Well, we do these light shots because the surgeons, you know, injured these nerves with their cuts. And unfortunately, the medical system doesn't acknowledge this procedure. So they were developed by a doctor called John Liftoff. He's from New Zealand, and he travels the world training other doctors. I took his training, and you can go to his website, and he has like an index of physicians around the world that he has trained. So the web address is Liftoff. So the way you spell that, he's from, I think, the Netherlands or somewhere weird to me. His spelling of his name is Lyftogt med, med.com. So liftoffmed.com. And he has a directory of physicians around the world. I'm not in that directory because I don't do this anymore. But this is often a miraculous treatment. This can get you off of opiates or any of the other drugs they use. We know opiates have contributed to the opiate crisis that we have in the United States and the opiate overdoses. The problem with opiates is that you develop tolerance to the medication. So you have chronic pain. And plus, for a pain like this, she took opiates. It didn't help. It didn't even, it just barely took it was absolutely not worth taking. So it doesn't always work. When it does work, a lot of times after weeks or months, all of a sudden it's not working anymore. It was working, now it's not. I got to take a bigger dose. Well, you over time inch up that dose. That's what leads to overdoses, because opiates will stop you from breathing. And so that can be fatal when you stop breathing. That's an opiate overdose. And so if your tolerance to the opiates goes up, but you still need the same pain relief, so you up your dose. And then, you're in the misery in the middle of the night with increasing pain because you develop tolerance to the opiates. You might bump it up a little more, and it might be too high to allow you to breathe normally. And that's the opiate overdose, which is very common. We have over 30,000 opiate overdose, most of them prescribed by their doctor, most of the opiate overdose deaths.
So I think a lot of us are familiar with the opioid crisis that we're dealing with right now. In terms of these alternatives, why do you think they're still under the radar? Why are more people talking about these?
Yeah, it's interesting because I actually worked in the past in an office that had what are called the interventional pain specialists, that do the corticosteroid injections of, say, a nerve root in the back or the neck, or a cortisone injection in the knee or the hip, or some other joint that's hurting, to do some intervention. The other intervention that they commonly do for back pain is they'll go in with a microwave, and they'll actually kill the nerve. So there's a sensory nerve, as I mentioned, that I injected with this woman, and then sensory nerve that I injected with sugar. Now it's a whole nother talk about why does sugar work that I'm not, I don't want to take that much time today to talk about this, but just take my word for it. Sugar makes pain go away if it's the right mechanism. So if you smash your thumb with a hammer and I inject some sugar in there, it's not going to make that pain go away. It's the pain associated with chronic pain that will go away with sugar. Now, why that happens is speculation. There's some speculation that sugar acts as an anesthetic, just like lidocaine does. And there is evidence for that in the old literature, that they could inject sugar and it numbed you just like lidocaine does. And the other is that maybe the sugar adds energy to the nerve so it can start to heal. So there's different theories. But I think the problem here, I was talking about the interventional pain specialist. I did this treatment on them for their little aches and pains that they couldn't go away. These interventional pain specialists, and they were happy with it and thanking me and all this stuff. And I go, well, now you're going to use this in your practice, right? And they go, no. They go, I looked it up. We don't get paid anything for this. It doesn't have the right diagnosis code. I get paid $400 to do a shot in the low back, and I would get like $50 if I inject you with sugar water. And then I'll probably get called out on it going, what, sugar water doesn't do anything. What are you doing that for? Lose your license.
So it's more of the structure in which practitioners are operating.
Yeah. It's like, I can't make a living doing this. I'm probably not going to do it.
Then you have to adapt to our business model of just serve for free, and then for those who need extra help, have health coaching. Otherwise, you're strapped to the insurance pretty much, it sounds like.
Yeah, so they couldn't do it and make a living. Now, there are a lot of doctors out there, like the ones on the liftoff list, but these doctors charge cash because they're sticking their necks out. Learn this. It takes years. that first case I told you about, I was still shaky on it, and I'd been doing it for a year. I would say it was another year before I go, bring on the pain patients, because I felt like I can decide right away if this is going to help you or not, and I know you're going to be a happy camper once I fix you. But it takes 2 years to get to that level. 2 years on your own of you know, just looking at his little diagrams that he gives you and going, okay, the nerve's supposed to be here. And it takes forever to learn properly. So the guys that do it, most of them are cash pay, and they really have to be if they want to make a living doing this.
Right, and that's just another good example of how profiteering seems to come before patient care, unfortunately, in our system. And then if you're a doctor within it, it's like you didn't go through all of that training in medical school and everything to not even be able to survive financially. So it's playing in perfectly for the big dogs on top, but not so much for the patient. So it's good to know about these alternatives, and go check out that website that my dad mentioned if this is something that interests you, if you are dealing with that chronic pain, because my dad has a lot of success stories, and I'm sure there's a lot on that website as well. So go check that out. Is there anything you wanted to add in terms of these treatments?
Well, there's another treatment that's very similar. It's called prolotherapy, and prolotherapy is where you're using a greater concentration of sugar water, and that's more used for a structural problem like a tendon that's torn or a joint that has arthritis. And there's a website called Get Prolo, Get Prolo, PROLO.com, getprolo.com. It also has a directory of physicians that do prolotherapy. It's the same problem with prolotherapy. Insurance specifically doesn't cover it. Medicare doesn't cover it because they make a determination. They go, this is experimental, even though it's been done for 60 years successfully in this country. It's still experimental. So Medicare doesn't even cover it. So again, you'll have the same issue with you have to pay cash, but it's well worth it because one of the other options for, say, arthritis or chronic tendon issue or something is to take the non-steroidal anti-inflammatory drugs, which a lot of times, even in the pain clinics, they want to start you out with those drugs. But those drugs really have some bad side effects. They significantly increase your risk of having a heart attack within the first week. So here's a drug that could just kill you right away. I don't know if it's worth 8 hours of pain relief to die over it. Now, I'm not saying, 1 out of 2 died, but I'm saying it's a significant difference. That is like a black box warning on those drugs. They also cause ulcers in your GI tract, stomach, intestine, and those ulcers can perforate, and is another leading cause of death is a perforated ulcer. So the non-steroidal anti-inflammatories can kill you off in 2 different ways. Then the third problem with them is they slow the healing process. So if you say go play tennis hard and your knees hurt because you have the beginnings of arthritis, and you take ibuprofen, and yes, it relieves the pain, but at what cost? There's studies that show that your joint space, so when we do an x-ray, the space between the 2 bones, called the joint space, is the cartilage, which is invisible on x-ray. And so if the joint space is narrowed, then we know your cartilage is wearing away. Well, the non-steroidal anti-inflammatory drugs like ibuprofen, there's some studies that suggest that they make that joint space close or get to the bone-on-bone arthritis more rapidly. So it's really good, for somebody who wants to replace your joint to make your disease progress more rapidly. Now, the cortisone injections, another powerful anti-inflammatory, does the same thing. So you'll get your total knee replacement faster if you have a series of cortisone injections in your knee, or even if you take Advil. or one of the other anti-inflammatory drugs. So these drugs have a definite downside. Do I say never take these drugs? Yes. But even I break down and take an Advil once in a while, and it is an amazing drug. And I see why so many people take them. It's the easy way out of pain. But I try to not to do it if at all possible.
Yeah, I mean, it seems like Advil is one of those backs against the wall type thing. Like, this pain's excruciating and I'm not going to be able to sleep because this tooth hurts so stinking bad. Like, let's use it tonight and see if it feels better tomorrow type of deal. Yeah, you don't want to be the type of person who's popping Advil for every headache type of thing. Like we've mentioned, meditation and yoga are also great for just kind of that maintenance to work through that pain on a daily basis. And now you have some other alternatives for those of you that are dealing with pain that you just can't get away from. You might want to go look into these before you start popping the pills, which have a lot of side effects and are highly addictive. So keep this in mind. Anything else you want to add?
No, I think that's the other issue with opiates that I didn't mention is that you can also become addicted. And so an addiction is you have a craving for the feeling they give you. And so addiction is not looking for pain relief. Addiction is the opiates make you feel better. So you feel better about your life. And so you're compelled to keep that feeling going. But that's a dead end. You can't have the opiates be the reason you feel better, or it ends in disaster eventually.
So I hope this information's been helpful. Make sure to go check out our other videos where we talk about a lot of different topics, all for free, of course, because we're really here to serve you guys. If you're interested in potentially working with my dad, myself, and our team of experts to put together a comprehensive plan for you on how to get your health back on track, you can check out our website too. We do have information on that. But if not, just enjoy the free stuff and make sure to go implement it. Implementation is extremely important once you learn what to do. So we appreciate you tuning in, and we'll see you on the next one. Thanks, Dad.
Thank you.